All right, guys, it's time for the Next Level Guy Show, a men's interview, interest, and improvement-focused podcast featuring interviews with the greats from all industries to help you better your life. Each week, a new episode features an interview with one of the greats, covering all aspects of their story, from life hacks to tips and protocols that have allowed them to live life on the next level. We then highlight concrete action steps that you can use to improve your life. And now, your host, Ian Dawson Mackay.
Today's guest is Dan Dworkis. Dan Dworkis is an MD, PhD, and is a board-certified emergency physician and the founder of the Emergency Mind, which brings together lessons from experts in the emergency department and beyond on developing the tools it takes to succeed during times of crisis and applying knowledge under pressure. Dr. Dworkis received his MD and PhD in molecular medicine from the Boston University School of Medicine. He performed his residency training in emergency medicine with Harvard Medical School, at the Massachusetts General Hospital, and also at Bingham Health. He's worked in some of the largest and busiest emergency departments in the country, and he's currently an assistant professor of emergency medicine at the Keck School of Medicine of the University of Southern California. And in this interview, we discuss his story, the emergency mind, how to utilize the mindset of an ER doctor to complete your goals, how to overcome fear, skill development, and how to use the habits and tactics of the emergency mind to thrive under pressure and perform at the next level when it truly matters. And now, let's get to the interview.
And thanks for having me, by the way. I've been really looking forward to this, so thanks for making the time.
You're a brave man coming on here.
Well, Gustavo said great stuff, and that means a lot to me. He's a pretty awesome dude.
Well, that was something I was wanting to go into, actually.
Yeah.
How long have you trained with Gustavo for?
I have been doing martial arts since I was a little kid. I started when I was about 8. My dad actually trained with Chuck Norris back in the day. Before Chuck Norris was like sort of a big deal, when it was just, Chuck Norris's karate school in Encino, California. And I was like a really pudgy kid into reading Dungeons and Dragons. And I think my family quite appropriately was like, great, let's get this kid into some martial arts. Which is one of the best things that's ever happened to me in the universe. And so I started training when I was 8 back in Texas. And we did a little bit of jiu-jitsu back then. It was mostly sort of karate and taekwondo. But my instructor was really open, really forward thinking, and had gone out and actually he had trained with the Machado family for a long time. And so brought that back to us. But it's only really been, and then it's been a long sort of like awesome journey through Muay Thai and Sanda and a lot of other things, but it's really only been in the last maybe 3 years that I've been pretty much solely focusing on jiu-jitsu. And I've been lucky enough to train with Coach Gustavo for that since I've been out in LA.
Cool. I mean, can you tell us a little bit about, firstly, who are you? Because you've got an awesome podcast, you've got an awesome SEP, etc. But, you came to me with an approach to come on because you had like a great understanding and a skill set you could teach people. But for people who have never heard of your podcast, and I know it's going to explode after this one, but, how would you define what the Emergency Mind podcast is, who you are, and why you feel that you're the right person to talk about these sort of things?
Absolutely. So my name is Dan Dworkis, and I am an emergency doctor out here in Los Angeles, California. And I'm the creator of the Emergency Mind, which is a space that brings in lessons both from the emergency department, but also from beyond, with a goal of trying to help everybody, not just emergency doctors, get better at performing during times of crisis and at applying knowledge under pressure. So, whether or not you're an ER doctor, you're going to face emergencies in your lives. We all do. And what it takes to not just survive, but really succeed during a time of crisis or an emergency is a really different mindset and a really different skill set than what we use in our day-to-day lives. And so the Emergency Mind is all about taking the best lessons that anybody's ever figured out under times of pressure and trying to distill from them these core concepts and techniques that we can start using in our lives right now.
Because that's what I loved about your material, your sort of content was you weren't just these kind of niche podcasts where you discuss your particular area. You would always go on to sort of explain how people could use it in the boardroom, how they could use
Hmm.
it in their particular job. And that's what some places forget. They talk too much about their own particular niche area and they forget to relate it to somebody who stumbles across a podcast or somebody that wants to find out about it but how to use it in their own life. But were you always that kind of kid? Were you the kid that in the group where everybody's panicking because we had broken like the tree hut or whatever? You sort of took charge. You could remove the emotion from it and sort of not panic in these situations. Were you always that kind of natured person, or is this something you've had to develop over the years?
Yeah, I think that's a good and that's a really important question too, because I think it's easy to look at people that are, excellent performers. Some of the folks that you've had on the podcast before, or I look at some of, my colleagues who are ER doctors that are just sort of like wading into waves of crisis. And it's easy to look at them and be like, oh, they must have been like that their entire lives. But I think that's sort of a myth. I think like nobody's really born like that. And that really it's a skill, that performance under pressure is a skill that any of us can develop. I mean, I look back at like my first day of my first week of medical school, and that first week you're sitting there in your tiny white coat and you're like super proud to be where you are, and you know nothing about, you are the proverbial like nothing Jon Snow, and you are like, they take you in to see a patient, and you just like it's overwhelming even talking to a patient for the first time, right? And I remember distinctly mispronouncing my own name and being like, oh man, how am I, how am I ever going to go from mispronouncing my own name to being like successful at this? But the truth is that like, you know, you learn and you grow and you keep putting yourself in these situations that are harder and harder, and you develop the skills that it takes to succeed and to stay calm at it. Um, so I talk a lot on the podcast about this word sang-froid, right? This French word. It's a combination of sang meaning blood and froid meaning cold, and this idea of cold-blooded, of the mental and physiological state of being cool under pressure. And I really truly believe that that's a thing that we develop, and as long as if we choose to, we can develop that and train ourselves into that. But I certainly don't think I had it, from the time I was a little kid.
So, can you explain to like if you had to sum it up, what would you explain as the emergency mind? Is it the ability to remain under pressure, or is it the ability to sort of see everything, but like be involved, but also be able to step back and see the whole process? Not just see the wood, but see the trees as such. How would you define what the emergency mind is for somebody listening?
Sure. So I think that when you find yourself in an emergency, when you find yourself in a situation that has stress, uncertainty, and this potential for really high impact, your brain and your body change. You deploy a different set of algorithms and packages and physiologic sort of responses to that set of crises. And you do that, I do that, everybody does that. And to me, that whole set of skills, the mental skills, the physiologic skills, the thought algorithms that we use, that is the emergency mind. So we all have one, right? Our body defaults to something. And if you think back to a time in your life when you were in emergency, maybe you were in a car wreck, or you're about to be in a car wreck, or you're in a really tight spot in jujitsu, like these things happen. Your body and your mind just changes, and so we all have one. The problem is if you don't train it, it probably sucks, right? You're just having this set of responses that are a lot like flailing, um, and to me, training it is the idea that you can take that sort of raw material and shape from it something that is useful. And so what is the emergency mind? It's the set of these mindsets and algorithms and physiologic processes that we can deploy when we are deep in crisis, that will help us get through it, help us succeed at it, and help us bring sort of the best possible version of ourselves to bear.
So, how do we make sure then that we have a growth mindset towards that sort of area? Because a lot
Yeah.
of people just get stuck with that fixed mindset where they just go, "Oh God, panic," and they start shitting themselves and shouting
Hmm.
about, and they get aggressive and stuff like that. So, how do you enable people? How do you train and get to the point where we can understand this and want to develop ourselves? But like, why do some people crumble and others rise to become heroes during emergencies?
Sure, sure. So, so that's a great question. So the first step is just understanding in your own mind and really believing that there's possibility for change here, right? If you think you are the type of person that's going to crumble and like, at the first sign of trouble, just like vomit all over your shoes and collapse, if you believe that is truly the only way that you're going to respond, then that's how you're going to respond, right? So the first step is understanding, hey, like this is a skill and a choice. And even if it seems terrifying to me, I can get better at it. And then the second thing is to sort of commit to yourself that you're going to become a student of this. And I like what you said about the idea of a growth mindset, because it really is committing to being a lifelong student of performance under pressure. It's not a thing that we ever stop doing, right? And it's not a thing that there's ever a perfect way to say, great, here, I'm gonna give you this little pill, and then all of a sudden you're gonna eat this pill and you're gonna be a total, an absolute. It's not like what's the right metaphor here? It's not like Spider-Man, right? Peter Parker gets bit by a radioactive spider, and then all of a sudden he has magical powers, right? It doesn't work like that. It has to be a series of learning and a series of growth and experimentation on yourself. And so that growth mindset, that idea that you're going to constantly push the line a little bit, and then you're going to reflect on what happened and try to build yourself better over time, I think is the first most important part to it. Um, in one of the episodes in my podcast, I had a friend of mine, Amy Hildreth, who's a lieutenant in the U.S. Navy and one of the directors of simulation and education for one of the Navy emergency residencies. And she came on and talked a lot about the idea that sometimes it can be, when you're first starting to train yourself to think under pressure like this, most of us jump ahead to be like, oh man, how am I going to do when there's like a fire and 100 casualties and like 16 explosions? And that's like so big and so overwhelming. And it really shuts you down and might get you right back to that vomit on your shoes and collapse kind of idea. But instead of starting all the way there, what if we start really slow, right? What if we take something today that makes us a little nervous, that we're not sure we can handle, and push ourselves just a little bit and just keep piece by piece taking the more sort of like Kaizen approach to it, more piece by piece building our ability to respond under emergencies.
Because that was something I was going to ask was, what do you believe about the Kaizen mythology of
Mhm.
like going and continuous improvement, that you're never actually finished? Because that's something I've learned while doing this podcast is the top tier people, the top performers are not always born just better than everybody. It's
Mhm.
the work they've put in, the growth they do, but the fact they never stop learning, they're continuously pushing themselves and learning and developing. But you know, something I really liked about your show was, I think it was your episode number 1 where you were talking about what you do during the first stages of an emergency.
Mhm.
Like when a nurse runs in and tells you that, you got patients inbound and you might not even have met your team by this point if you're locuming and things like that. What's the first sort of steps do you do on an individual basis to prepare for an emergency? Like say there is the big explosions and the tunnels collapsed and all that sort of stuff. What do you do initially before everything else to kind of center yourself, to calm, to before you can, start planning and prepping everything?
Yeah, so I can't talk about individual patient cases, but I can tell you that the other day I was running a unit, and we got an exact call that said, "Hey, this building had just exploded. There's an unknown number of inbound casualties, and they look pretty sick. You have anywhere between 3 and like 25 inbound casualties, and you have anywhere between like 2 and 10 minutes. Go." So this is a really real question. And sometimes in our lives we get this warning like, hey, there's something coming right at us, and we have a minute to prepare. And sometimes we don't, and we only realize we're in an emergency like a few minutes into it. And either way, you have to find something at the beginning that sort of drops your normal mindset and puts on your emergency mind. You have to have that on switch, that the sort of like the moment that you really start firing it up. And so when we talk about the emergency mind, the first pillar of it, we have sort of these 4 pillars that we can talk about at some point today, but the first pillar of it is this idea of accepting reality. That the first thing that you have to do is understand, okay, this is an emergency, I'm in an emergency, I'm going to deploy my skills. And the more energy you spend, if you sort of take the opposite approach, the more energy you spend denying that you're in an emergency, I don't want to handle these patients, I can't do this, we can't do this, everything is terrible. All of that energy, and you can't see me, but I'm literally making the hand motion here of like pushing things away from me, right? The more energy you spend fighting reality, the less time you have to prepare. You waste all that energy, you can't get it back, and energy that's not pointed directly towards your problem is energy that's wasted. So for me personally, what I do is I take a deep breath. I usually say some version of like, all right, Dworkis, let's get into it. And then I actually check my own pulse. So it's pretty simple. I just put two fingers on the radial pulse on my wrist, um, and I feel a couple of heartbeats, and that does two or three things for me. So one is that one of the first things they teach you in medical school is how to take your pulse. Um, and it reminds me of sort of where I've been in the training that I've been through. So I know I can check my pulse, and it reminds me of all the other times I've checked my pulse over the years, all the times that I've been through hard situations with really challenging, very sick patients that we've had to care for, and all the times we've made it through. And if I've made it through that, then I have enough skills, and I'm going to try to make it through this. The other thing it reminds me of is that you never know how many heartbeats you have left, but I can feel this one right now, and I get a choice of what to do with it. And for me, that sort of reaffirms my choice that no matter what's going to come through those doors, I'm going to use these heartbeats the best that I can, and I'm going to do everything I can with me and my team to take care of it.
I really like that because I did similar before I kind of found out about, I think you called them tactical pauses,
Mm-hmm.
whereas I used to do a bit of the CBT, kind of, like cognitive behavior therapy, and I
Uh-huh.
would do the 3 deep breaths,
Sure.
and I would try feel my body again, because usually when shit's hitting the fan and I've got students asking me for stuff and staff moaning about stuff and you've got 50 things juggling, you don't know what to jump on, just sometimes remembering that you're a person sitting on a seat, that the world's not ending. And I know it's different for you where you've got somebody's life on the line a lot of the time and you've got another person waiting and then another person. For the majority of us, we sometimes forget. We get so wrapped up that it's like seeing the wood for the trees. We
Mm-hmm.
forget that we can step back and breathe and react to this. So something I really liked about your podcast was the idea of the 4 sort of stages. Can you go into a little bit about that? Because you've alluded to one just now, but what's the kind of overview of these 4 stages that you do?
Yeah, absolutely, man. And just before diving into that, like what you're saying is so true that for me it might be taking my pulse, and for you it might be taking a couple of deep breaths. And we talked a few minutes ago about the idea that you have to become a student of yourself for this, right? You have to understand that nobody's going to figure this out for you, and that it's really going to be up to you to figure out how you best respond under pressure and to study it. So when you find yourself really stressed like that, when you find yourself in a crisis, experiment with this a little bit. Try to take some deep breaths. Try to check your pulse. I've got a friend of mine that makes an okay sign with his left hand. I don't know, that wouldn't do anything for me, but that's what he likes doing. Um, when I was doing more Muay Thai, I would like bang my gloves together twice before the beginning of every round. Like whatever it is that centers you, whatever that motion is, that sort of anchor movement, like you have to sort of experiment with that and figure out what your own personal version of that is. Um, and the idea, sort of one of the underpinning ideas behind the emergency mind in general, is that now is the time to practice that, right? By the time you find yourself in the center of a crisis, in a real emergency, it's not the time to really be experimenting. That's the time to deploy, take action, and move forward. So when you need to explore, when you need to experiment, when you need to grow is now, before you're in an emergency. And so you have to commit to doing that growth now, even though you're not really in the center of the crisis. Um, but all that said, to answer your question, when I think of the emergency mind, there are really 4 things that ER doctors do, or that we really try to do during every critical case, and those are we accept reality, we act from within, we deploy sang-froid, and we try to play for the future. We talked briefly about the idea of accepting reality, but really what it means is committing to be here now, is knowing that whether or not we like it, whether or not it's what we wanted to do, this is where we are. This is the reality of our lives, and our patients, our family, everybody around us depend on us accepting what's happening and moving forward with it. Um, uh, there's this great there's a band I like, the Real McKinseys, that has this song called "The Best Day Till Tomorrow," which I think is like a perfect metaphor for that. Like, no matter what you're facing, this is actually the best day you have until tomorrow. Doesn't mean it's a good day. It doesn't mean it's the day that you want to wake up and have. And I think that a lot of us are sort of wrestling with ideas like that right now in the middle of the coronavirus pandemic. But this actually is the best day that we have to deal with whatever it is that we're dealing with. Um, and sort of taking that mindset and moving forward with it is the first idea. Sort of committing to being here and committing to doing your best. Um, the second part, acting from within, has a lot of grounding in Stoic philosophy, which we can also dig into as much or as little as you want. But it's basically the idea that there's stuff in the universe that you have control over, and there's stuff that you don't. And especially in the middle of an emergency, anytime you spend any energy you spend on things that you don't actually have any control over is energy that's wasted, and it's less energy that you can deliver to your patient where and when they need it. So understanding where you have control, which is entirely internal, right? How can you change yourself? How can you change your attitude? How can you change your own sort of thought processes? This is where you can make a difference. So it's about recognizing that and playing from that sphere of control. Um, Sang-froid, I mentioned earlier, the idea of it literally translates into cold-blooded, and there's this great quote by Napoleon that says, for my troops, panic must be drilled out and sang-froid instilled. I think when I started this whole process, I thought that sang-froid was really a simple sort of idea of like, oh yeah, you just don't panic under pressure. But as I've come to study this more and talk to more people and do more research about it, it strikes me that sang-froid is really more complicated than that. It's a pretty complex mental, but also physiological state where you're able to use things like biofeedback to sort of um, alter your body's mental and physiological responses to stress to optimize your performance under pressure, not just to survive, but really to optimize it. Um, and then the last thing we do is we try to play for the future, which is the idea that whatever we're doing, whatever things come at us, whatever emergencies we find ourselves in, we try to act in a way that connects that to our broader vision of reality and our broader vision of the universe. Um, that sounds a little high-minded, but what I really mean by that is that uh, one thing is we try to never waste any suffering, right? People suffer, and a lot of times there's just simply no way to stop that. The person in front of you is suffering, but can you treat them? And as you're treating them, can you learn things? And as you're learning things, can you turn around and teach those things to other people so that maybe the next person that comes in can suffer less? And that idea of never wasting the suffering that you're seeing, of connecting whatever you're doing to sort of the broader idea of treating humanity. Um, so yeah, that's a lot for one swoop of me talking, but that's the idea. Those are the pillars that make up the emergency mind and sort of what we train and deploy training and tactics around.
Yeah, I love that because that is something when you've got a fabulous podcast. When I listen to the guests and the breadth of the discussions are really amazing, and I was really impressed by the quality and the depth you went into of each area. When something I really liked was the bit about I can't remember the exact episode, but you talked about making peace with the fact that you can't control everything. Now, most people, they come in and they'll start saying, okay, we need to do that, and I'll control that and do it over there. But a lot of times, you're maybe just out of medical school. There's nurses there with far more experience than you. You maybe don't know the situation you're in if you're maybe in a foreign country helping out, etc. So, how do we make peace without being able to, not being able to control everything, and being able to decide if a patient dies or not? Because a lot of us, we focus solely on the thing and it crumbles us if the outcome isn't successful. But how do you make peace with the fact that you can't control what happens? I think you told a story, somebody told a story about 2 twin babies had died in Haiti, and
Yeah.
that's heartbreaking to look at, like the resources available in different countries, but that would have destroyed me. Could you, like, talk a wee bit about that, but like how can we make peace with then going into the next room and being able to just fight solely for that patient rather than letting the past experience continually build up on us and infect how we act.
Yeah, Ian, that's such a rich set of things, man. And I wish that there was a single sort of like bomb of wisdom I could drop and just make that easy for everybody. But I don't think that's how the universe works. So let's come at that from a couple angles. One is you talked about how can we sort of um, the words you used were sort of like decide who lives and dies in an emergency, and I am under no impression that I have that power at all. I don't think any doctor does, and I certainly don't. I think that the universe does what it will, and what we can do is sort of decide: are we going to step up and give the best we have to offer, or not? That is really my only choice, right? My only choice in any case, in any day, is am I going to deliver the best version of Dan Dworkis that I possibly can to this patient? Um, and that really goes backward to the question I would have faced the day before, which is, am I going to train today so that tomorrow I can deliver the best version of Dan Dworkis possible to that patient? And that is the fundamental question that each of us has to answer for ourselves every day. And that gets into so many things that you've talked about in your podcast with your guests as well, right? In different versions, which is essentially that question: am I going to do the training today that needs to happen so that tomorrow I can be the best person I can? Um, you know, uh, there's another idea in there that you talked about, sort of about how do you handle a really challenging outcome when the outcome isn't what you want it to be, when somebody dies, when somebody suffers. And and I think that there's two things to talk about here. One is the Stoic idea of memento mori, right? Which is the idea that remember that we are mortal. Um, and I think that it's something that we unfortunately avoid a lot in our culture, which is that we don't talk about death, we don't think about death, we don't think about what that really is. And so part of my answer to your question there is to say that you know people are going to die, and you cannot stop people from dying. You can't stop yourself from dying. And so what do you do with that? Right? If you really sit down and dig into that and make yourself uncomfortable and sit with that and think about the fact that you're going to die, how do you get up the next day and keep going? Well, for me, that makes me more excited to get up the next day and keep going. Right? There's this great Japanese poem, and I'm blanking on the name of the author, but it basically says, "Look, if today is my day to die and I die, so be it. If today is my day to die and it turns out I don't, even better." Right? The idea that like if you're able to really process that and take yourself into the mindset that you will die, and then you get another day tomorrow, man, what an amazing gift. Um, so I think that's part of the answer to it. The other thing for me goes back to a really, really important structural difference between performance and outcome. So, um, the have you ever read the book Thinking in Bets by the poker player
Uh,
Annie Duke?
Not yet, though.
Totally awesome. Strongly recommend it. She's a professional poker player that talks a lot about the mindset of poker. And in it, she has this idea of a matrix which separates performance and outcome. So imagine you have a 2 by 2 matrix, and one side is performance, which is good performance or bad performance, and the other side is outcome, which is good outcome, bad outcome. So performance is all of the set of things that we control. Okay, it's how I act, how I think, how I train, how I do anything that falls within me that I have control over. An outcome is what happens in the case, which is a mix of performance, things I have control over, and the will of the universe or the roll of the dice or whatever you want to say, things that I don't have any control over. And I think that if you tie yourself to outcome, um, then you're sort of at the whim of things outside of you. But really, all you can control is performance. And so, one thing that I try to do when I'm faced with these really difficult outcomes, these really tragic cases, people suffering and dying, is to try to subset out from them, to look backward and subset out from them. And Annie Duke calls this process fielding. But to separate out what is performance, what part do I have any control over, and how did I do there? and how can I do better at it, and to really, really be honest about what I have control over and what I don't. Because otherwise, I don't know how you could get up and go into the next room, right? If you were responsible truly, personally, for the life and death of every patient, that would be overwhelming. What I am responsible for is to deliver the best I possibly can to that person and to their family. And then I'm equally responsible to the next person in the next room over and their family. And so figuring out, you know, how to draw that line between what is within me and what is outside of me, what do I have control over and how do I do it, is a really strong skill set. And again, the idea is to start small, right? So in your day-to-day life, like, can you stumble into a situation that had a good outcome or a bad outcome, and step back and say, okay, well, let me practice dissecting that. Like, what part of that was performance and what part of that was outside of my control, and how can I learn from that? What can I get better at on the performance? Um, so yeah, I think that's part of where that idea of peace comes from.
That's brilliantly put. I mean, that's something I liked about your podcast was you didn't shy away from the negative side of people will die. You
Yeah.
know that we are all dying. We're not always guaranteed the next day, and I think that's the beauty of people like Tim Ferriss, Aubrey Marcus, is they're opening people up into the understanding that there could be like a pandemic like going on just now, where a virus could start killing off people, and it's just no rhyme or reason why some people go
Yeah.
and to live life the best we possibly can. I mean, so how do you then analyze a situation after? How do you review a situation after you've gone through this? You've not crumbled under the pressure. You've thought, you've looked to the future, etc., and you've maybe saved a patient, or you've got them to start the process where they can then go into like the other departments to start like their long-term recuperation.
Mhm.
How do you analyze each situation, if it's negative, positive, whatever it is, to then learn from it, to grow that mindset, to develop the skills, to use a better version of Dan for the next patient?
Yeah, absolutely. And you mentioned Aubrey Marcus. So first off, I don't want it to come off like I am a perfectly cool human being in all situations, because I think that wouldn't be correct, right? I think we're all learning and we're all growing. And so I
Mhm.
actually met Aubrey Marcus the other day at a coffee shop in Venice, and
Awesome.
had like a 1 second conversation with him, during which time I just thanked him for what he does, because I think he provides a lot of value to the universe. And
He's quite an intensive guy, isn't he?
oh, absolutely. And I was a little nervous to come up and talk to him, which is funny because I was actually sitting writing part of the Emergency Mind at the same time, talking about being cool under pressure. And then I'm a little jittery coming up and meeting this person, and I immediately spill coffee like all over the table. And I was like, oh, good, good. Just another reminder that, like, I'm still in process and still learning how to be a better version of myself here. I don't know, maybe I'll sit down and talk to him about that story one day. Um, but you asked a sort of deeper question in that, of course, which is, how do you post process something and how do you learn from it? Um, I think a really important thing to think through is that at different times you're going to be better or worse at processing and understanding things, and some of that has to do with what else is going on in your body and mind. Right. So if you sit down immediately after an event, like seconds after an event, and start, trying to do a really in-depth root cause analysis, it's probably not going to be super useful. So, I mean, imagine Ian, you're on a mat and you have a really challenging role with somebody, and you get stuck in a Kimura, and you've been trying not to get stuck in a Kimura, and you're frustrated. And if I told you to sit down and, like, journal for me 10 minutes about that, that probably wouldn't be super useful. Right. You've just got too many things, too many chemicals stirring in your body, too many like different responses going on. And so one answer to your question is, I try to design different types of processing based on what's happening. So immediately after a challenging event, I will do more of a clearing, right? I'll do a reset button. I will sit and take a couple breaths. I'll check my pulse again. I'll try to let that wave of stress and that wave of which often is a good thing, not a bad thing, right? The chemicals and the sort of responses our body brings to get us ready for a complicated situation. I'll let that even itself out. And some of the research out there says that takes at least a minute and a half or so to really, really, really wash out. or at least for the first part to wash out. So I'll really do nothing. I'll breathe, I'll check my pulse, I'll walk around. Then, when I'm a little bit more able to process, the first thing I'll do is usually a team-based debrief, where I'll take everybody that was in the room, the nurses, the other doctors, if there are any, the respiratory therapist, the pharmacist, and I'll get us there in a circle, and we'll talk through what happened, do sort of an immediate after-action report. What went well, what didn't go well, uh, and we'll start with just sort of a narrative, like what happened, like what did we do, what did we do well, what do we think went wrong, and then we'll always end that with a question of what did we learn from this that we can immediately change, and what did we learn from this that we can start the process of changing. And so that might be, hey, we learned that the oral airway device, which is a thing you can use to put in somebody's mouth when they're not breathing and sort of stent it open to get a little more oxygen in there as you're setting up to maybe place a breathing tube. That really needs to be stocked in a place that is reachable from the head of the bed. Okay, cool. That's something we can change immediately. We can just tape one to the wall, right? Or maybe we learn something more systemic, like, hey, when there's this type of patient coming in and we have 2 minutes, we need to make sure that our protocol is to set up the room in this configuration. Cool. We can start that process of learning for the future. So that's sort of like the second wave. And the third wave is the idea of sort of floating this both internally and externally. So internally, I might sit down and write about the case. I might talk it out loud. I might go back, and one of the other doctors I interviewed, Dana Sajid, in episode, I don't know, maybe 7, talks about the idea of running a case backward in his mind and just sort of changing things, either randomly or on purpose, and then trying to imagine how the case would have gone differently, which is a skill I really like and definitely has some applications to jiu-jitsu training as well.
Definitely.
Yeah. And, or, if I'm lucky enough to have residents or other, sort of junior doctors with me, I'll often run the case with them and see what they come up with. And they're constantly pushing me to think up better ways to do things, which I totally love.
Because I've done that too, where you look back at a situation and think, what if I did this? How would it have affected that? I was always a great believer that you could teach anybody about medicines and protocols and stuff, but it's the people skills as well. It's the ability of like how you lead, how you control people, etc. But something that when you had the interview with Andrea Austin, I think it was, where she mentioned about the being cognitively depleted, and I loved that phrase. How do you keep going this? Because we have this image of doctors, especially A&E doctors and those kind of doctors, where you're constantly working long shifts and getting just a barrage of people coming in and all different kind of things. When your like mind is getting tired and you're trying, you haven't got a coffee and things like that. How do you keep your decision making and avoiding burning out? How do you keep it for the seriously important things and not worrying about the little things? I think you talked about being loose and tight. You could see the humor of a situation, but not lose the seriousness of it. How can you talk about, like, when everything seems a priority? How do you not avoid just burning out, panicking? Is it you go back to these like visualization, these techniques you've learned, or is there a method you can do with your diet, with yourself during the day to help?
Yeah, man, that's a great question. Certainly you can make it worse, right? Which is a weird way to answer that question. But, you can take a situation where it's full of pressure and you definitely can make it worse. And how would you make it worse? Well, probably you don't sleep the night before, you don't eat that morning, you eat a lot of really crappy, sugary stuff, and you get angry and you don't take the time to do the stuff that helps you feel better, if that's yoga or training or breathing or whatever. You can certainly make it worse. The opposite is also true, which is that you can optimize yourself to make better decisions under pressure. And part of that is what you did the day before, right? Sleep and eat and hydrate and manage your caffeine. Part of that is, a thing that I am still experimenting with, and if you or anybody listening to this has ideas, I want to hear it. I always am asking my teammates about how they train themselves to make better decisions, and that's from sort of like a physiological standpoint. From a mental systems standpoint, um, it's a really fascinating question. How do you design mental systems that support you in making good decisions, and not just, as you mentioned, the first good decision, but maybe the 100th good decision in a row? Um, you know, the Knowledge Project podcast out of the people from Farnham Street, Shane Parrish, had a really interesting episode a couple of months, maybe almost a year ago, with Daniel Kahneman, who's the Nobel Prize winning economist and the author of the book Thinking Fast, Thinking Slow, which is a really amazing book. And Shane Parrish asked him a question, which was essentially, do you think we can ever, some version of like, do you think we can ever train ourselves to really overcome um, the bad habits of our mind? I'm paraphrasing wildly here, but uh, Kahneman, who's like the world's expert on this, had a really fascinating answer, which was essentially no. I think that the human mind has been designed by evolution to work a certain way. And rather than try to overcome it, what we should do is try to understand it and build systems that support it. And to me, that goes back to the idea of accepting reality, right? Like, I'm never going to be a perfect brain. I'm just not going to happen. But can I figure out how I work during the course of a shift, during the course of a match, whatever it is, and train myself to sort of strengthen up where I need strengthening and exploit where I already am strong? So, for example, I might decide in certain circumstances to become slightly more conservative towards the end of a shift. I might order slightly more testing. I might think a lot harder before doing certain treatments for a particular patient, because I know, like everybody, at the end of the shift, my brain works slightly differently than at the beginning of the shift. It's not to say it's better or worse. It's just over time, the way that you think changes a little bit. Um, and you can develop a lot of techniques to sort of strengthen yourself in those systems. But first is realizing that you need that you need to design systems to support your thinking in different points of the day.
Because I think you've seen that. I think you've mentioned it as well. I've mentioned it on the show before about the survey that was done that looked at people who were going up for a release from prison, and you were more likely to get parole after lunch than before it.
Yeah.
And it's just little things like that that can be, it's nothing about you personally or your case or the situation. It can be just about somebody's blood sugar level and what they've eaten. And it's scary that a lot of people don't realize that and how it affects what they're actually doing. I mean, something, I'm going to probably butcher this quote, but somebody wrote a cracking thing that really helped me, where it was, don't set goals, don't set deadlines, build processes, and you'll succeed. And that's what I always try to do, is always have a protocol for something, regardless of what it is, of how I'm running something in my home or at work or in the podcast. I always have procedures that if I email you and you tell me to fuck off, then I do step, step, step. If you say, yeah, I can do it, but not in 6 months, I go, okay, step, step, step. I always have procedures for everything. Now, do you think this helps a sort of emergency doctor, that kind of understanding where you can be dealing with nurses who, if you took that nurse away from using the CPR, you would kill the patient. If you took the nurse away from administering XYZ, it would kill the patient. But it allows a doctor then to see the overall thing and project manage the situation, but also remove the emotion from it, so you can see, when to stop, when to change tact if something's not working, but you let people focus solely on their job, if you know what I mean. Because you're a big component of jiu-jitsu like I am, and this has really helped me kind of, controlling what's happening in my arm, what's happening in my legs, but also seeing the overall, how long's left in the timer, how long is left in the match, am I winning, am I losing, am I in a strong position, am I going to get swept? How do you develop these things, but still, you know what I mean, but still not get caught up in it?
So I want to clarify. the question you're asking is about how do you develop protocols that let you see the field, but also the details. Is that right?
Yeah, like how do you? Because this is a problem with your materials. I get so kind of involved, and there's like 50 or 60 things, and I'm trying to keep it separate, but I'm just like it all links together so well. And because I've been so fascinated by your show and learning about this stuff, 50 or 60 things come together. So I could already see an episode 2 coming. But yeah,
Right
how
on.
do you deal with like project management,
Sure.
but also see the bigger picture?
So we talk a lot in the emergency department about the idea of the cone of focus, which is the sense that like, what's actually in your field of focus right now. And there are times when the appropriate thing in your field of focus is really tight, really, really, really contained on one thing. If I'm placing a central line, which is a you know, 15, 20 centimeter long intravenous line that goes into the jugular vein, for instance, which is a relatively in-depth procedure, involves cutting into the neck and placing this device into the jugular vein. My focus is entirely on, especially in the 1 or 2 moments of that procedure that are absolutely critical, that is the entirety of my focus. And then how do I learn to zoom in, so to speak, on that moment, and then immediately zoom back out to see the field of the other 15, 20, maybe 50 patients that are around that I'm also responsible for. And part of that comes with practice, and not necessarily. So like anything, there's an idea of like sort of like random practice, like you just do things enough and it spins off learning for you, versus the idea of a more purposeful or what Anders Ericsson would call the deliberate practice, that talks about you're really, really training and experimenting around an idea. And part of it is the idea that once you do things a couple of times, it costs you less energy to do the same mental process. So a decision that you've made before costs a little less. Certainly true in jiu-jitsu, right? The first time that you got out of a guard, it was this massively complicated procedure. It still feels like that to me some days, depending on what's happening. But when it works, I'm like, right, this is like smooth. I understand this. Like, yeah, that's how this is going to go, and it costs less energy, and so you're able to devote more of your attention to other places. Um, I think that is an okay answer to your question, but not a great one. And part of that is that I'm not sure that there's a totally well understood answer to that. I mean, I think that's an area of really active inquiry and exploration for me, is how do I best make the types of decisions in particular that require me to zoom in on a thing and then zoom immediately back out. And I guess a more perhaps relatable example to people that aren't cutting into people's necks to placing central lines, which hopefully is most people. Is you're driving and you're going around a really complicated turn, and then a person cuts across the lane of traffic, and you have to really rapidly decide whether to swerve or not. So that's a moment when your focus is really tight. You have everything you have on this like 1 or 2 little movements you're going to make with the car. Immediately afterwards, though, you then have to reset and zoom back out and sort of re-understand where all the other cars are around you in space. Because if you don't do that, if you're still focused on the minutia, you're going to slam into the next thing next to you. I don't know. Does that answer your question?
Yeah, I mean, do you think then that in that using kind of understanding the procedures, the protocols, the how to use a certain bit of equipment, does that help then remove the emotion from an event where, because you know that the patient comes in and they've got like a collapsed lung, the procedures to reinflate the lung, how to get them stable, how to incubate them, etc. That does it take the emotion away then, because it could be any name on it, on the top of the chart, because step by step by step, or in jiu-jitsu how to do an armbar, but step by step by step, it doesn't really matter in the opponent, it's more kind of you dictating how to get them in a situation to do the armbar. Do you think
Yeah.
like
Yeah, that's a good, man. I'm gonna answer a very subtly different question that I think gets back to it, right? So the question of does it take the emotion away? No. I have not found the emotion disappears. I've found that I'm a lot more able to handle it in a way that it is productive and useful, and that takes that emotional charge, that energy that comes from the emotion, and helps me do better for that patient. Right? I'm not contrary to what perhaps if you got some ex-girlfriends on the show, what they might think. I'm not a robot, right? I do actually have I do have emotions like everybody else, and I don't think ever, no matter how good of an ER doctor I become in my life, I don't think I'm ever going to get rid of emotions. I don't think that's the goal, right? The goal is to be able to feel the emotion, to handle it, to understand what it's telling you, and then to find a way to use whatever arises, whatever energy arises, uh, to redeploy your skills for the patient in front of you. Um, so the other day I was working in an emergency department, and I had with me a scribe, which was a college student who is going around to help you sort of write the charts, and they're there to see emergency medicine. And we had a patient who died, and we'd taken a moment of silence for the patient, and we're sort of regrouped and ready to go to the next thing. And the scribe, she turned around and asked me, um, does it get easier? Do you stop feeling the death of your patients? And I thought about it for a minute, and um, I've been in full practice for about 3 years now, and in some version of emergency practice for about 7. Uh, and I said no. It still tears the same size hole in you every time. But the more you do it, you realize you're a much bigger piece of fabric than you thought you were, and you're a lot more connected to the rest of the universe. So the hole's still there, but relatively speaking, it's a much smaller part of everything else. Um, and I think that's what I'm going for, which is to stay calm and to use the skills, but not to stop feeling humanity.
I love that, because that's the sort of difficulty of it is that you don't lose you get to a point where you're not just so wrapped up in it, the fact it's a baby in front of you and worrying about it, etc., that you forget to do your job, but you also don't lose the fact it's a person in front of you. And I
Right.
think that's what a lot of people forget is I always say to people, it's the person that you're shouting at on the phone is a person. It's the person that's helping you is a person. So if we speak to each other like human beings, it's amazing. It's hard to teach people skills. It's easy to teach people how to do certain bits of how to work technology, etc. But we can't always teach them how to be a good human being, and that's where I think people struggle. Because
Absolutely.
doctors are super humble, they're super genuine and compassionate people. How can you teach compassion? Or are people born with it? How can we learn to be like doctors and nurses and like that look after people and give it all to save somebody? How can we use those kind of that personal skill set to in the boardroom in our own jobs?
Yeah, I mean, first off, that's very generous of you to say that most doctors are humble, nice human beings. I think that's like I think we that's like mostly true. I think we certainly, or I at least, I can't speak for all doctors. I certainly aspire to be that, but I don't think that it's a skill set that is unique in any way to doctors or nurses. I think that it's more of a step before that, which is you know, there is suffering and there is challenge and there are emergencies. And every one of us has to make the choice about whether or not we're somebody that would step up and try to help, or we're not. And, because the truth is, there's no one coming from outside of us to save us like this, right? Whatever's happening, it's going to be up to us and our communities and our families to take care of ourselves. And so if we make that commitment and say, I'm going to step forward, then, and I'm going to learn how to step forward, then that's a big movement on the path. Um, and oh shoot, there was something else I wanted to say. Um, Lost it. Sorry.
That's what I always find is like you can go on and I'll start asking a question about one thing. I'm thinking,
Yeah.
right, I'm going to ask the next 3 questions, and 20 minutes later, I'm kind of combining 50 or 60 different things. I can see people kind of going, how the
Yeah.
hell am I going to answer that? Because I get so wrapped up in your material that it kind of, I live it almost.
Yeah.
And sometimes I can't break it down enough I'm doing it for myself. I forget sometimes to do it for an audience as
Yeah.
well,
Yeah.
to kind of
Definitely.
explain it step by step. But I mean, we can go on and throw it back in later on if you want. So, what's your opinion then about training this? You know, when you get a new student who's coming in medical school, how do you use things like technology, visualization, dummies, and things like that? How do you explain these kind of procedures and then start ramping it up to the point that somebody's doing it on a real person to then doing it by themselves and controlling a team? How would you see the training develop and change so that the next generation of doctors can be more, sort of better with emergency mind and better handling these kind of pressures and situations?
Yeah, absolutely. I mean, I think that that this question applies not just to doctors and people in medical training, but to everybody, because I think the question is a fundamental one for all of us, which is how do any of us become better at handling emergencies, right? Because like if you look at the difference between me now and me, when I started all this, certainly there's like knowledge differences, right? There's what's the dose of amiodarone, there's what's the number of um, joules I'm going to defibrillate somebody with. But actually, it's more about the same reusable skill sets that are true for everybody, which is how do you function better under pressure? And if you're going to train to function better under pressure, then ultimately you have to train with pressure. And so what that means is, and this is something that's a number of folks on my podcast have talked about in um, everything from explosive ordnance disposal to jujitsu to surfing to emergency functioning in medicine, which is the idea that you want to learn a skill, whatever that skill is you want to deploy under pressure. You want to practice that skill, and then you want to slowly ramp up the pressure until it gets uncomfortable and you start failing a little bit. And then you want to back off and learn about it. And you want to sort of turn it back on and turn it back off, that level of pressure like that. So there's this great book, The Pressure Principle by Dave Allred, who's among other things, a world-class rugby coach. And that area where you're having enough pressure on that your skill is breaking every now and then, he calls that the ugly zone, which I think is a great way to put that, right? You want to train in the zone where you're looking a little ugly. Um, and his point, which I think is really well taken, is that you can break down individual components of a skill, right? So let's take jujitsu, which I don't at all to pretend to be a master of or a master teacher in, but okay, actually, so let's shift gears. Let's take throwing a punch, right? So because for a long time I actually did teach Muay Thai and Sanda. And had the sort of real joy of taking a number of people from never having done martial arts before to sort of through the first steps of their journey into doing a striking art. Um, and how do you learn to throw a punch, right? Well, you sit down in front of a mirror and you watch some mechanics and you practice a few times. Then you put some gloves on, you take some pads, you hit once or twice, you stop, you feel where it feels different. Then you throw it a little faster, you throw it a little harder, then the other person throws back at you, and you're sort of gradually ramping up the thing until it's a thing that you can deploy almost mindlessly. Um, but that idea of getting good at it and then ramping up slowly, and and more importantly, allowing yourself to be in a space where you struggle, and knowing that that's actually the goal. Like being in a space where you struggle is actually the goal. Like you're going to work on getting better at it and you're going to improve your skill, but there's not this idea of, for me at least, there's not this idea that you're going to reach some space where everything is going to be fine and there's never going to be any struggle again, right? The only version of that I see is like death. But otherwise,
Uh,
I'm going to spend the rest of my life training in a space where I struggle. And I think, embedded in that question you asked was how can we train the next generation of doctors to be better? Well, one thing I fervently believe is that everybody at my level, everybody who's the attending, who's doing the teaching, needs to be really honest that we are also learning, we are also students, we are also exploring. And then together we can have this culture where everybody is learning and exploring, where you're doing exactly what you're doing on this podcast. You're trying to get better at things. You're talking to people. I am, our students are, everybody together understands that our goal is experimentation and improvement, not like finality and stability.
Because that's the thing I always say to people is I'm far from an expert in anything,
Hmm.
but I want to learn, I want to develop, and there's too many gurus who tell you that this is the only way to do things. Like look at jiu-jitsu and how many people will tell you that this guard is better than that guard, or people will tell you that in business this is the way to do it, which might work for somebody with a certain kind of skill set, qualifications in a certain environment, but it's not going to work for every single person. um, I mean, that's something I know they say in jiu-jitsu is you learn the best when you're tired and you're
Hmm.
rolling 50 or 60 different people. So apologies for my notifications going off. But I mean, what is it about the Stoic philosophy that attracts you? I mean, it's something that a lot of people are now becoming more and more popular with, like the Tim Ferriss 4 Hour Work Week and things
Hmm.
like that. But how has that helped you adopting this kind of philosophy to your medical care, to how you view life and deal with the emergency mind and things like that?
Yeah, absolutely. Stoics are a totally amazing group of philosophers that I was pretty lucky to be exposed to when I was younger. And I think that, their core tenets, which are uh, accepting the reality of the universe the way that it's built and understanding that the only space you can control is within yourself, and sort of letting the rest of the universe be what it will. Um, are really really grounding and motivating for me, and obviously have a lot in common with sort of the first two pillars of the emergency mind. um, and I think that a lot of this started for me after realizing that over and over again I would go up against these big life or death issues with patients, and that I'd be sort of sitting on the edge of that life and death over and over again and going up to bat against it every day, and realizing that what does that mean about my own existence, right? What does that mean about existence in general? And starting to dig into some of these deeper, bigger questions, which is what the Stoics were there for, right? That's what they believed. And Stoic philosophy is a and just if you're listening to this and you've never really dug into the Stoics, Marcus Aurelius, Seneca, and Epictetus are sort of the three big players in the world. And I would definitely start with Marcus Aurelius's Meditations. It's his own journal to himself about how he wants to improve as a human being, and it's really easily accessible. Um, I'd skip the first chapter, by the way. I would definitely start with chapter 2, just for whatever that's worth. Uh, the Stoic philosophers are really about not theory, not philosophy in the abstract, but philosophy as practiced in day-to-day lives. And the idea that, hey, we're going to take these big things we believe about the way the universe works and boil them down into our actions and judge our actions based on how well they line up with what the deeper truths we think are. And so that really resonated with me in terms of how can I do a better job at functioning during an emergency, and how can I really give this person and this family the best that I have to offer. Um, and sort of having that feedback loop in terms of, all right, well, am I really lining up my deeper priorities with what's happening in the day to day? And there's a number of like specific Stoic concepts that are totally worth digging into. We talked about Memento Mori. Um, there's another one that Tim Ferriss talks about a lot too, which I'm going to totally butcher the pronunciation of, but premeditatio or premeditatio malorum, which is the idea of sort of thinking ahead about the bad stuff that's going to happen. So for the Stoics, they would do this, and they'd think ahead of time about, they'd visualize themselves getting diseases, or losing a limb or losing a family member, and they would do that to train their resolve to act appropriately no matter what the circumstance was. Um, there's another version of that, which is thinking ahead about the bad things that are going to happen and making sure that you are ready for them. And that same skill set is something we use all the time when we're about to perform a really critical procedure, right? So let's say we're about to place a breathing tube. We'll sit there for a moment and actually collectively, and say this out loud, say, hey, we're going to run, a pre-meditatio malorum package right now. Let's all sit down and think about everything that could go wrong and make sure that we have contingency plans, backups, probabilities, and have our tools ready to go. So I think we're, in some sense, we're actually really directly using Stoic philosophy techniques in the emergency department. Um, but in a more general idea, everybody has the ability to really try to think for themselves about what are these deep things, and am I really living a life that's consistent with them?
It's time for a quick break. There are millions of potential products to buy, so how do you know which ones are worth your hard-earned money? Simple. You go to nextlevelguy.com/affiliates and explore those that will transform and improve your life. You'll find deals, listener exclusives, and special offers with some great companies. Recommendations are 100% honest and only on items Ian has tried or believes in. The companies showcased will make you a better man in all areas of your life. Simply go to nextlevelguy.com/affiliates and level up.
So, what would you say to people who then think, well, it's surely just about repetition? You just need to see 50 patients with X, Y, Z, and you're going to learn, because people seem to think that, I think is it the Malcolm Gladwell, like 10,000 hours. And you try to explain that, but yes, that's the case as long as it's proper training. You can't just, otherwise the oldest and most experienced person would be the best physician, best board member, whatever it is. Like, what do you think about that kind of idea of practice and skill development to the point, because people will say about visualization where the brain doesn't understand the difference between what you visualized, like deeply and emotionally, as much as what you're learning, training. It can be just as good in terms of skill development and things like that. But what's your opinion about skills and developing, and repetition? And is it about experience and repetition, or what makes a good doctor in that sense?
Yeah, sure. So Malcolm Gladwell, when he was thinking about the 10,000 hours, was really quoting this study by Anders Ericsson, who wrote this great book, Peak, which is a really interesting book to read and dig into. And his idea, I believe this study was done in musicians in a conservatory in Germany, looking at the difference in the practice hours between the highest performing and the sort of less highly performing musicians. There's a bunch of other stuff coming out now that I'm not super facile with the data about, that says maybe that number isn't really true. But even if you ignore that for a second, because the question is really about, do you get better with repetition? Or if not, how do you get better? And so certainly you need repetition as much as possible. But I think some of the details come out in terms of what type of thing you're doing, right? So if you're learning a skill where there is immediate and visceral feedback about what you're doing, then repetition is going to be really, really useful, right? If you and I are in a jiu-jitsu class and you have me in a half guard and I'm trying to smash your half guard, and I try 100 times and you defend 100 times, that's going to be a good learning cycle, right? Because there's immediate visceral feedback about what happens and what doesn't, and we can stop and dissect it in between each case. We can minimize the number of variables we're training on. We can say, okay, for the moment, we're going to not, switch to butterfly half. We're going to stay in half. Okay, cool. That gives us a space within which we can learn, and we can really hit that sort of ugly zone that Dave Allred's talking about and hit our reps in. It's a lot more complicated to figure out how to learn something when perhaps there's a long delay time between the outcome and your evaluation of your own performance, to go back to that idea. And so that's a lot more complicated. And then you get into these things that, like, in emergency medicine, there are sometimes procedures that you have to do to save a life, but that maybe you've never done before. Maybe they're just so rare that you've never done them before. So I think about when I was an intern, my first year of emergency training, there was a patient who was very sick and was actively exsanguinating and dying because they were vomiting up so much blood. And it had a long history of liver failure. And so we had to place a device called a Blakemore tube, which goes into the esophagus and inflates. It's like a balloon in the esophagus to sort of block off that bleeding. And it's one of these things where, okay, if you don't inflate it enough, the person bleeds to death and dies. And if you inflate it too much, their esophagus explodes and then they die. So very, very small margin of error there in the middle. And as it turns out, nobody in the entire emergency department honestly, in the entire hospital, as far as I know, that day had ever actually placed one of those before. It's just that rare of a thing. And now we do it more or less, or there's other things, but at that particular day, nobody had been available to do that, and so there were no reps in. Right, there was zero time to get reps, no reps before that. I had seen one once, and so that actually made me the most skilled operator in some sense. And so I, went in there and put it in and figured it out. And thankfully, that story has a good outcome, which is that the patient survived. Um, but yes, repetitions are important, and also trying to learn cross-cutting principles about how to operate anything when you don't have the ability to run actual reps on it. And part of that can be overcome by things like visualization, things like simulation. And I think that applies obviously not just to emergency medicine, but to everything. You're going to find yourself in situations that you've never been in before, that you haven't been able to practice. But what is this package of things that you can rely on no matter what's happening? And that really is the purpose of the emergency mind, is to help you build those tools.
So what is this kind of experience of, like the years that you've worked in medicine and, sort of become an emergency doctor, etc. But what's it taught you about leadership, sort of like running a team, the networking, the people skills? Because you can plan, for having so much equipment on site, but you can never know exactly what's going to come, and you can never exactly remove the emotion from the situation. And like you don't always get a chance to review and analyze each situation before the next one comes in. But what has it taught you about leadership in the sense, or being the person that stands up to when the things need to be counted?
Yeah, I think that first off, leadership, like a lot of the stuff we've talked about today, is a choice, and it's a choice to be a dedicated student of it or not. So the best leaders that I see when I watch teammates of mine run a resuscitation, what I see is people that are deeply dedicated to a particular cause, that they are able to share that vision with the entire room, and that are able to express themselves both as a master and a student in the same moment. And that the first two parts are somewhat obvious, right? Like, you have a cause you believe in, and you're able to share that vision about what's important. And the third part's a little less obvious, I think, which is that you're in charge. It's your word that goes, and being able to communicate that effectively and to do that are a whole bunch of skills that we can talk through. But also at the same time to have that openness to the fact that you don't know everything, that there's a bunch of other eyes in the room, and that your goal is not to be correct and your goal is not to be perfect. Your goal is to take care of that patient. So when I was training, I got a chance to work with an ER doctor, Chuck Posner, who runs this thing called the Stratus Center for Simulation. So he's a world's expert in teaching and simulation. And he said, look, if I give each person in the room a test about medical knowledge, you guys are all going to score individually some numbers, maybe 80%, maybe 90%, whatever it is. But if I give you one test and I let the entire room take it together, you're going to score 100 on it, because collectively your knowledge is what's going to count. So the question is, when you're in the middle of an incredibly tense situation, how do you take the knowledge of the entire room and deliver it to that patient where and when they need it? And part of that has to do with that Jocko Willink talks a lot about the dichotomy of leadership, but that difference about being at the same time a master and an expert at your craft, but also a student and open and able to receive knowledge from everybody else.
Because that's what I loved about your talk, where you talked about, I can't remember the monk's name, and then you mentioned Jocko Willink, and I was just like, I loved that kind of the difference between the two of them. It's where that we have to be good enough to take charge and control the situation, and stand up and say, this is how we're going to do things, this is what we're going to use your skill set that you've got, but you've also got to be able to accept that you don't know everything. Mm-hmm. Humble enough that there is somebody there that maybe knows better, or a more experienced person, and try to use other people and their skill sets. I mean, that's why they always say that the best leaders will never try to run everything, but they'll find the right people for the right areas to make the overall goal achievable. So what do you think now? I mean, we're in a situation, obviously, that the whole world's dealing with the latest pandemic, the coronavirus, or is everybody? And I think there was something where 36% of Americans would stop buying Corona beer because they thought they had something to do with it.
That's too bad.
Well, let's not go into that right now. But what do you think about the medical care system as a whole? Because back when Ebola was a big thing, there was a talk where there was a couple of TED talks about how we're not ready for the next pandemic. That we haven't really kind of prepped for anything, that these things are going to keep coming, that we haven't got like the stuff ready, the medicines, the necessary skills, that we're not planning and doing anything for it. So what do you think about the way the medical systems are different around the world, and how we don't seem to learn from these pandemics and mass sort of hysteria events?
Yeah, that is complicated. I think that first off, I hope if you're listening to this that you are doing okay, that you are appropriately taking care of yourself and staying relatively socially isolated for the moment. It's a great time to listen to more podcasts and dig in like that. I think that these are complicated questions because they drift away from simple medical issues and they drift into much more complicated issues of how society works, how we want society to work, and then also how our society actually does work. What is the cohesion among all of us, and how much do we feel the need to take care of each other versus ourselves? These are deep, what does it mean to be human questions that we're bumping up against with this. I think that an ideal healthcare system would provide healthcare for everybody. That's part of why I got into emergency medicine, because I never wanted to say no to somebody because of who they were or what type of insurance they had or what their family was. I want to be the one that says, you have a problem. Yes, I'm going to try to fix it. But as we move through this, my hope is that our systems of healthcare all across the world, and both on a big scale, country to country, but also on a smaller scale, community to community, neighborhood to neighborhood, city to city, my hope is that we can be really open with each other and learn from each other about what works and what doesn't. And oftentimes we have this sort of shell around us, like, oh, I know best, and you're sort of backwards, or maybe you're good at that, but I'm better at this, or whatever it is. And this sort of unnecessary ego about it. And I hope that we can drop that and we can learn from each other. The idea that we incorporate in the emergency mind, playing for the future, this speaks directly to the idea of not wasting suffering, right? We have put an enormous shock on our system, and we damn well better learn from it. We better figure out what happens, and we better prepare ourselves for what happens next, because this, when we get through this, and I truly believe we will, this isn't going to be the last time something like this happens in humanity. And we need to learn reusable lessons from this, and to compare notes. And again, that gets to that idea about being a master and a student at the same time, right? Being somebody who's open to learning and open to experimenting. And instead of adopting a stance that says, I am the best at this, to adopt a stance that says, this is what we're trying to accomplish. Let's figure it out together. At least that's what I hope happens.
Yeah, because we never seem to. Sorry, I was actually looking earlier for I think it was a Bill Gates TED talk I was looking at, where he mentioned about we don't ever seem to learn from that. Then people go and they panic buy, and we get to a point where people forget about other people, and I really hope we can get to the situation where you're advising where people can actually learn from these situations and put protocols in place to help for the next one. Mm-hmm. But for the people that you deal with consistently, do you notice something about them? I mean, I know anybody could fall off a ladder, be in a car crash, but what kind of advice would you give to people just now? Because you get these people who go to A&E for silly things and they want to get antibiotics for XYZ, where a lot of times it's easier for the body or better for the body to kind of learn to defeat it itself. What advice would you give to people from your medical knowledge? Is it improved diet, more exercise, meditation? What habits would you want to see people doing to try to live healthier lives?
Yeah. I mean, I would recommend against falling off a ladder for sure. Uh, but but I think there's two ways to answer that. One is right now in this particular climate where our healthcare systems are stressed to the absolute max. I would definitely be in favor of, if you are feeling sick, talk to your normal doctor first to help figure out if it's the right thing to do to go into the emergency department, into the A&E. Um, from a broader sense, I think that it goes back to the same thing we've been talking about, which is becoming a student of yourself. Like, you really have to believe that your health can get better, that you can learn about your body, that you can improve your systems, and that you can, through a combination of self experimentation and also absorbing the best knowledge that's out there, that you can live a healthier, better life. But it all starts with the idea that you're going to get curious. You're going to get curious about yourself and how you work. Um, and I think that a lot of us don't necessarily have that. At some fundamental level, we're sort of a stranger in our body, or maybe we're even scared of it, right? We don't know what it means when it makes this noise or it hurts in this place. Um, and that goes beyond just sort of, uh, eat more of this or eat less of this, but it's about understanding, like, how do I feel? How uh, how does my body feel when I treat it this way versus when I treat it that way, and what is healthy and what is good? Um, but I'll throw a word of caution in there, which is that, like, it's also you can take that to the extreme, and you can say, well, I feel great, so I don't want to listen to what anybody else is saying, and that usually ends up in disaster of one form or another. Um, we There's a tension between only doing naturopathic stuff and also listening to some of the best advice out there from pretty detailed, well done scientific studies about what medicines are helpful for us. Um, and I think that there's a version of this where imagine what would an amazing future look like, right? It would look like a group of people that were clued into their own bodies, that meditated, that did restorative practices like yoga, and also aggressively strong practices like jujitsu. That were strong and fit and healthy and happy and able to take care of each other. And despite everything that's happening in the universe right now with Corona, I totally believe that is a thing that is within reach for us. But it requires each of us to take ownership and to step forward of it.
And that's something a lot of people want to avoid. It's easier for me to say, oh no, the doctor should do that. Oh no, the guy at work should be starting my diet. Oh no, the X, Y. It's easier to kind of blame somebody else. It's the government fault. It's hard to say, yes, I could be, looking after myself. And then we tie up injuries to our story. It's like, oh, I used to play football. My back's been bad since I used to power lift and stuff like that. And I interviewed Kelly Starrett, the postural coach, and that's what he was saying, is we should be living to 100. We shouldn't have these sore knees or the bad hips. We shouldn't be in pain getting out of a chair. And, we don't take ownership of ourselves, our lives, our ability to be healthier people. We kind of just assume that there's always going to be resources to fix this. And these kind of pandemics are scaring people now because there isn't the food to go around. There isn't people checking on the elderly or the vulnerable and I think that's what's kind of scaring people, is you're realizing a lot of times it might be just you looking after yourself, taking ownership of your health. And I think it kind of scares a lot of people. What's your opinion then on the American pay for play? Would you like to see an NHS style over there, or?
Yeah, I mean, I think there's so before answering that, there's one step backward, which is, we're talking about personal responsibility for health, and that is incredibly important. We also have to recognize that the playing field is not even to start with, right? That there is vast amounts of structural racism and violence and things that make it a lot harder for certain groups of people than others to do those things, to take care of themselves, right? And if you look at the data on like food deserts, and if you look at the data on access to care, these things, at least in the US, are not at all equal, and there are people where the ramp is a lot higher to get up on. So I think a better, I said earlier, there's a vision of healthy people taking care of themselves. I think a better version of that vision is healthy people taking care of themselves in healthy communities supported by healthy systems. And that's sort of
Mhm.
the universal vision of like what it would take to build a really successful society like that. And those systems have to be in place, like you said, to check on the elderly and the infirm, to help people when it's not as easy to help themselves in that moment, and also to empower everybody to take care of themselves, and to own that version of themselves. I think that's a more inclusive, better way to say it. uh, but to get to your question, like I am a firm believer in the universal right to healthcare. I absolutely am. In some sense, we already believe this in the States. We just don't really talk about it that way, because if you fall down in the street and have a heart attack, you're going to go to an emergency department and we're going to take care of you. It doesn't matter who you are, what insurance you have. It doesn't matter if you are a US citizen or not a US citizen. It's irrelevant. Like, we have agreed as a community that we will not leave you dying on the street while we look through your wallet for your insurance card. And like that's damn right that we don't want to do that. The problem is that for some reason we haven't agreed that we will also figure out a way to prevent that from happening for you, which doesn't make any sense to me. So I really, I think the NHS system is wonderful in some ways, and challenging and perhaps flawed in others, like any one individual system is. So I think it's hard to
Mhm.
say I want to adopt that system, but I do believe that we all should have access to healthcare. And again, perhaps this is a great opportunity for people to be sharing a lot more data and models about what works and what doesn't work. Um, and having that ability to be open and learn from each other is the first step towards designing a system that does work for everybody. I wish I had a I wish I had a perfect answer to what that is, but um,
Because that's the thing, isn't it? Is that we are now in a generation where, for the first time in ages, we have such a high level of elderly people living much longer. We have to start thinking now about people not sort of dying off in their early 60s and stuff like that, or people like able to work a lot later, and we haven't got the care systems in place, and we don't know what's going to happen with some of these diseases or medications and stuff like that, because with it we don't have the data to see how things are going to go. And that's the beauty about sort of what you do, is that you don't discriminate, you just deal with the person, and then you get them healthy again. And I think that's the approach, is rather than thinking about it in terms of helping ourselves, we should be helping each other and looking out for each other. And it's scary how society kind of breaks down when it comes to things like these, and we're not just helping each other. And yes, we should be looking to hit the next level in our own lives, but we should also be looking to help others and get better and leave the next generation the best version of the world we can. And at the moment, we're not doing that. We've become a very selfish generation, and I think everybody goes on about the millennials and stuff like that, but it's kind of sad the way we've become as men. I mean, what has it taught you working in medicine about like men and masculinity and their approach to the world?
hmm. Yeah, man, that is a deep well of questions right there. I think that I have been incredibly lucky in my life, both in terms of the people that have taught me and the role models, both men and women, that have been there, that have taught me how to be a better version of myself, and that have demanded and expected that of me. Um, and I'm incredibly lucky to get a chance to work with my patients, you know, many of whom have been through nearly unimaginable levels of suffering and hardship, and have emerged, um, while not necessarily physically healthier, have emerged, with these very deep, wonderful ideas about how the universe works and what to do about it, and have shown such courage and strength as they do it. And I think that, I'm I couldn't pretend to sit down here and tell people, what being a man is. I can tell you what it is for me, which is to master myself and serve the world. Right? That's my version of it, which is to sit down and spend my life mastering myself, mastering, to be a master of my body and my mind, which implies, of course, that constant student aspect of it, like we talked about, because those are really sides of the same coin. And then also to find a way to serve the world, to make that part of it, and that those two goals are equal in my mind. Um, I think that implicit in that is the idea that we have the responsibility to figure out our purpose for ourselves, right? Like that Viktor Frankl quote, man must not ask what the meaning of life is, but rather must recognize that it is he who is asked.
That's an amazing way of putting it, because it is something about it. It's not just what we can get out of life, it's what we can give back and how we can leave life better, how we can leave the world better. And I know we're sort of well over our time. I really hope that I've given any kind of justification, like, of how much I enjoyed what your message and your podcast and just what you do in the world, because you're doing an amazing work. That you're stepping up. You're one of those people that helps others live, that can take them off the brink of death and give somebody extra time, and help families even just come to terms with what's happening, and just giving somebody some solace or understanding, or sort of just some general human empathy during the times that at the worst is an amazing thing that you do. I mean, I would love to have you back on again. We can really start going deeper, but the stuff you're doing is amazing, and I really love the emergency mind and the way and how it can help other people. But for those people listening, what would you want them as a sort of go home message? What would you want them to take from this as a kind of a general reminder, or some actions to do in the next 6 months, etc.?
Absolutely. And Ian, thank you so much for having me on, man. It's an absolute pleasure to talk to you about this stuff, and to dig in. And I hope to come back and do it more. And I hope people listening to this are, uh, fired up a little bit about wanting to get into this, and also maybe feeling a little nervous about how to start, and not wanting to immediately start cutting into people's necks and putting central lines in, which is great. Please don't do that unless you're trained. Um, but what I do want you to do, what I would challenge you to do, is to sit down and think about emergencies that you've been through in your own life, and to imagine what a different version of that would be, where you were able to truly give the best version of yourself to that moment. And if that strikes a chord in you, if you said, hey, yeah, if I could have done that, that would have made life so much different, then how are you going to do that going forward? And my challenge is for you to start thinking about the idea that how you behave under pressure is a skill. And it's a skill that you have to learn, and it's a skill that you need to learn. And so to start with the small things, and today, tomorrow, the next day, when you find yourself reacting out of pressure, just start taking a note of what you're doing. How are you acting? What might be a slightly better, what might be a 10%, to get back to Kaizen, what might be a 10% better way to act right now? If that type of thing interests you, uh, you know, come over and check out what we're doing. You can go to theemergencymind.com. The podcast is there. You can sign up for our newsletter. We've got a lot of great stuff coming down the pipe. There's going to be a book in the future. There's going to be trainings. There's going to be all sorts of stuff. But whether or not you come over to what I'm doing or not, like, figure out how you work under pressure and how you can get better at it. Get out there and get after it.
because that's something I was going to say. Was it's definitely a book there. I could see,
Yeah.
seminars, conferences. It's an amazing you're doing it, and you're not just talking for medical people. You're talking about how we can all change and affect and become better people. How can we get in touch with you? Can you give the URL again, the social media handles? Like, what's the best way to start working with you in this area?
Absolutely. So the website is emergencymind.com. And that has everything. That has the podcast, although you can also find the podcast basically anywhere, Apple, Spotify, SoundCloud, kind of anywhere. But going to emergencymind.com, there's a contact form. You can fill that out and talk to me directly. You can email me directly. It's dan@emergencymind.com. Instagram is, I'm going to look this up as we're talking because I always forget what my Instagram name is. 1 second. Oh, here it is. It's d.dworkis. So D and then my last name. That's Instagram. There's a Twitter, but it doesn't really do anything right now. So, I would say those two are the easiest ways to get a hold of me.
It's amazing, like how you can never remember your own ones.
Oh, I know, right?
I always do it because somebody took Next Level Guy and nextlevelguy.com in some things, but Next Level Guy in others. And I probably should change that. I really hope that I've kind of done justice to what you're doing there, because I get so excited when I started listening to the show and diving into this sort of stuff that I sometimes can get a bit excited and combine different questions that maybe don't allow you to give full answers and stuff like that, because you are doing amazing work. But is there anything that you think we've not covered? Is there anything that you would like to talk about or mention that you feel would be helpful?
I think we've hit a lot of the stuff. We talked about what the emergency mind is and how you can start approaching it. I hope I've been able to convince you and people listening that this isn't just for ER doctors, right? This is for you, whoever you are listening to this, because you really will face emergencies, and what you do now today is going to impact those things in the future of your life. I guess the only other thing I'd say is that none of this is easy, right? There's no easy parts in here about redesigning how your brain and body work in times of crisis. And that's okay. It's not supposed to be easy. It's going to be hard, and it's going to be worth it. And, when you're in the middle of the training, just like jiu-jitsu or anything else, like, stick with it. Find people that do it with you and stick with it.
Well, that's it for another week. And thank you for listening. It's now time to take what you've learned and use it to develop and enhance your life with the key points mentioned. Listen, try it, embrace it, use it, and crush it. Now's your time to hit that next level in your life. If you liked this episode, then please leave a comment on the show notes or a review of the show on your podcast platform. Everything helps evolve the show. Until next week, keep seeking the next level in your life.